welcome. Just while I've got you here, I'm just busy finalizing the last of our recordings so that I can share those all on our mail distribution list. But if there's anyone who is eager to get a copy, please feel free to let me know on email, and I can gladly let you know. Just as a courtesy, we've got quite a big group who registered for this afternoon. So if you wouldn't mind putting your microphones on mute, that'd be great while I introduce everyone. Nice to see everyone again. Today we've got Dr. Julia Ambler from KZN, a specialist in palliative care, but with a specific interest in PEDS. And she and her partner run a beautiful organization called Umduduzi, and it's always lovely having Julia join us. You can see Julia's in KZN, looks like she's about to go down to the beach for a swim. Yeah, the rest of us are freezing in the rest of South Africa. Yeah.
It's been 30 degrees this week. We've had a few days, seriously, of 30 degrees.
I don't know. I went outside briefly this morning and I haven't braved it since. It's been too cold. So good for you guys. Our conversation today
made sense, but no acute symptoms that would have alerted us to test her ourselves. When she then tested positive, my husband and I went for testing, and we both came up as strongly positive. And again, neither of us probably would have tested if we hadn't had the exposure to my daughter, in that neither of us had very acute symptoms of a very sore throat, a cough, a headache. Both of us had been feeling tired, but again, put it down to stress and just normal life. I think the big thing when you have COVID is the mind game, particularly if you're medical. It's constantly, I would wake up and think, oh my gosh, I've got COVID, what's going to happen today? I did borrow a SATS monitor, and I found that very reassuring to just keep checking our SATS. I took it very easy. Obviously, I was completely booked off work. My husband continued to work from home initially, and I probably felt worse than him. On day 7, I got very bad, sharp shooting chest pains. And because I'd had some heart surgery as a child, I thought that perhaps I was developing a myocarditis. So I phoned actually Dr. Hoskin and asked for his permission to, under his name, just do some bloods. So I did a D-dimer and a CRP and an FBC. And interestingly, they were all normal, despite having a very high positive COVID swab. So that was very reassuring. And I think there is merit if you are concerned about someone chest pain wise or anything, that, you know, the bloods can help with saying this, you're going to get into trouble with this patient, their D-dimers are already high. None of us developed the terrible cough, although my husband and daughter are on asthma medication anyway, and they just doubled from once daily to twice daily on their Seretide. But last week, my husband for the first time felt really awful. So as I was starting to feel better, he then said he felt like he'd been hit by a bus and sort of went to bed for the day. So his came later. But what's been the most surprising is none of us have had very severe acute symptoms. But what is apparent now is the lingering vague symptoms. I've started to wear a Fitbit. I've gone back to work since Monday, and I notice my heart rate goes up very quickly. Just walking from my office to the tea room goes up to 110.
Hello, Sean. Are you looking
I think it's quite reassuring to know that you've got a reason for that, and it's COVID. And I think there's a lot of info out there saying you've got to be very careful with exercise once you've had COVID, and to really not do anything for 2 weeks once you've fully recovered, and only thereafter to very slowly build up. Interestingly, I've just got home from work and my husband said, He's booked to see a cardiologist tomorrow because he's very worried about his palpitations. And I think it's great that he goes and gets checked out. But interesting, Julia, that in the survey you said a third of patients complained of palpitations. So it's a mixed blessing. It's been nothing like I thought it would be in terms of no acute symptoms. Strange symptoms. My daughter had quite a bit of gastro, but now certainly thinking, now I understand why I'm not feeling 100%, and I need to take it. We all need to take it very carefully. I think again the mind games. My biggest fear is in 6 months they say, you know, we've shown that anyone who had COVID is 90% more likely to get breast cancer or Alzheimer's by age 55. It's the unknown that's very scary. And I've probably met as many, if not more, people who've had it and had it mildly and have come through than I have people who've had severe after effects. So I live on that hope that there are many doctors and medical staff included at our hospital who've had it and are now okay. If there's any long-term symptom, it's the fatigue and just feeling like you unfit is the best way I can describe it. So hopefully that's of help. What we did do is I felt better by putting us all on a regime that some doctors had put together. I think in Joburg, we did high-dose vitamin D for 3 days. We did vitamin C 1 gram daily. We did zinc high dose for 2 weeks, and we're continuing on the zinc and a B complex. Interestingly, we all got quite a bad gastritis, which I thought was COVID, but I actually think it was the vitamin C. So I stopped the vitamin C in all of us, and that sort of epigastric pain went away. So we couldn't tolerate that high dose of vitamin C. And I think that's always useful to remember is you always think vitamins are fine and you give high doses, but, vitamin C is an acid, and not everyone's going to tolerate those high doses that people suggest one should be taking.
Yeah. Having said that, though, in this particular survey that I'm referring to today, it's about a quarter of patients that are reporting reflux and heartburn ongoing, but maybe it is the vitamins and not the COVID itself. And this is the problem, that no one really knows. So I think this is the idea of today is not really to kind of frighten everyone into the thought that symptoms might never go away, but it's just to kind of pause and think a little bit about how do we support people that have been told to take it easy, but they can't because they don't have permission from their employer to do so. Very few people are allowed to take more than the 2 weeks, and the minute and now it's that the government has said down to 10 days, that, our health department is saying after 10 days, you will come back. As we can see, quite a lot of people have this persistent not feeling great. And our advice is, on the one hand, take it easy, take your vitamins. And on the other hand, you've got to go back to work. Anyone else have thoughts on that?
Hello.
Is there anyone? Hi.
Hi, I'm Taggy Nadirson. I'm from Durban.
Nice to meet you.
Yeah, good to be with you. Martin Buck asked me to join. I'm not sure whether Martin is online. So I'm 6 weeks post diagnosis. I've been in hospital twice. I had a high flow nasal oxygen, dexamethasone, Clexane. I'm a family physician here in New Orleans, working for about 40 years. And very early on, I was infected. I hear what you're saying, and much of it rings true for me also. The absolute malaise. I used to be a very fit guy, going to the gym 3 times a week. Could run up and down my home. I have a stairway inside, and that used to be my index of fitness, for running up and down all the time. I can't do that anymore. I wouldn't say, just feel insecure in my movements. The balance becomes an issue. I tend to walk past the chair and would knock it without knowing that it's there. Yeah, those are physical aspects. The taste hasn't come back. I mean, nothing tastes the same anymore. Very metallic. There's always no salt in the food. Things like that. And I can't tolerate Indian spices. I mean, we are Indian here, and curry is something that we eat and gone off that. But the main issue is the one of emotion and concern about the future. I have confidence because I have faith in the Lord Jesus Christ, and I know that He still will see me through this, and my hope is in that. And just to share with you that sleep is something difficult to have. I have small amounts of sleep, an hour, 2 hours maximum. Then I'm awake, doing some work. So I try to write. I use my phone a lot and do voice recordings rather than writing, because to write is too exacting, you know. Try to read and pray. But it's a very, very slow progress. It's people ask me, I tell them, no, I'm improving, but I know that the improvements are minimal each day. Thank you.
Sure, thank you for sharing that. It sounds like it's been such a hard journey already. And how are you? I mean, are you managing to still see patients, or have you taken some leave from your practice?
No, I've been put off till the end of August, still pending a review.
Okay.
Yeah, so I've seen the specialist in the hospital and the cardiologist. They don't think I'll be fit by the end of August.
Sure. And then what happens to your practice? You know, have you got a locum, or have you just shut it?
No, I do have a locum, fortunately, for 2 hours a day. Patients know about it. I mean, I've lived in this community all my life. I'm 70 in 6 weeks' time.
Sure.
And yeah, they are very sympathetic and understanding. So many of them come to the practice, and my locum would call me and say, I've got so-and-so, what do you think I should do? It helps.
Yeah.
And I talk to them on the phone, reassure them. Yeah.
Yeah. That's incredibly useful. Thank you.
Yeah.
I think you highlight so many of the issues that I wanted to raise today, just the kind of the psychological aspects and the sort of the unknowing, and that your spirituality has been probably as big a part of your journey as any of the medical doctors that you've seen.
Yeah, it is. It is. Martin is a friend of mine from the Christian Medical Fellowship, and I'm one of those who sings at most of the meetings. And I find myself going on to YouTube and listening to all live singing. Some of my old favorites like Andre Couch and maybe Don Moon and those more sedate music. But I feel when I listen to them, it does something to me. It raises my spirit. I think it releases my endorphins, and I feel the confidence to go ahead. Just to put some things in perspective, I had a choice at the end of March to close practice because I'm close practice. But I've been in this community for over 39 years, and I couldn't bring myself to leave.
Yeah.
And
yeah.
I just couldn't.
Doctors don't retire, hey? Andrew, did you want to comment?
Yeah, sorry, there was an interesting comment from Nelia Drink, and I hope she's still online with us. It's always lovely to chat to the colonel. Just the comment here is COVID is forcing us to focus more on anticipatory grief, and the secondary losses that we're experiencing. And I think those are also by extension, you know, the connections that we're missing, as GB pointed out. So I'd love to just chat to Nelia about that, because I think it's a very, very important point, because that will also impact the stress that we're under, and perhaps even the post-traumatic stress that we experience afterwards. Hi, Nelia, welcome.
Oh, thank you, Andrew, and hi, Julia. Long time no see.
Nice to see you, Nelia.
I was listening to Julian and also now to Dr. Nadisan, and the last speaker mentioned specifically the emotions that he was going through and still is going through, and then the loss of income, the planning in your practice, the scare, I think, or the fear that you can contaminate someone else. That GB said we couldn't be the support that we otherwise would have been for family members. So there's so many things to take into account here, and the problem is that we are all in this together. And it's not to say that or how do I support somebody if my fear is as high as yours? I think, yeah, that was just my thinking, and that we are all in grief at the moment for everything that we're losing out, and isolation. Yeah, I don't have to go further. Thanks, Andrew.
Thanks, Nelia. We always appreciate your input. It's very kind. I think, you know, Julia, the other thing that's as obviously important is, you know, we, you know, as people with interest in palliative care, you know, we take a broad approach to looking after people. And I think this also speaks to that important, you know, psychosomatic approach to things. And I think that, you know, there's that element during COVID where, you know, we need to support our colleagues and those that are sick. I mean, I heard it in passing the other day, and I actually realized, you know, that I hadn't even thought for a moment to, you know, pick up the phone and, you know, WhatsApp and check in, but just to like physically just phone and check in on people every now and again, because you think they almost want to do a bit of R&R. And I think, you know, there's just so much of a newness to this. It's crazy. But I think that you know, that finding the right kind of support is also important, and just offering it, I think, is vital. Especially in the recovery phase. You know, as Jane said, there's so much uncertainty and fear attached to it. You know, probably that level of empathy, you probably need your friends and colleagues more than ever.
Jane, did you want to comment?
Yeah, I was so overwhelmed by the community support that we got. I mean, we were 3 of us positive, and my son somehow managed to stay negative. And our housekeeper stayed negative, but we were given meals every day for 2 weeks running. And I found it quite embarrassing at a point, and there was a lesson to be learned in receiving, and that for many people who are not medical, haven't been frontline involved in one way or another, this was their way of feeling like they were contributing to a bigger cause that we all are involved in, which is this COVID. So at times I wanted to say, no, please don't worry. But then I was reminded that it was also important to let people give. And I think, as Andrew mentioned as well, the other lesson I've learned in this time is that as palliative care doctors, because we focus in on the skills of empathy, reassurance, humanity, that is an area where palliative care doctors have shown up in this time for colleagues and other healthcare workers. And I certainly appreciated, you know, a palliative care doctor who said to me, can I phone you every 2 days just to check in on you and just to see. And, you know, it was just so reassuring that, and, you know, I'm not surprised it was a palliative care doctor who suggested that. But I think we can all remember, and I am now trying to help an intern who's got COVID, and just to send messages and phone, because we think we're invincible, but it's actually quite frightening when we get it ourselves. Because as Nelia said, is you're the one normally helping people with their fears, and now you've got those fears, who's going to help you? So I think a positive is that it's another area where palliative care has really shone is not only for patients, but for other healthcare workers. I think we brought back that empathy and compassion into medicine during this pandemic, and communities as well, I think have really stepped up to the plate.
Yeah. Thanks, Jane. I see that Carol posted a question saying, are the symptoms of pain, memory loss, neuro related to medication given in ICU and hospital? And I'm not entirely sure on this, but certainly a lot of the patients that I've spoken to, they didn't actually end up in ICU or in hospital. They've been at home and perhaps had what Jane has described as a lower grade, less acute infection, but that has resulted in these long-term kind of painful symptoms. Tertia Berger's on the group and on the chat as well, and she's written, I'm just scrolling to find it. Tertia, are you still here? I don't know if you want to chat about what you're experiencing, if you're willing, but I see that you've had terrible nerve pain and a fast heart rate, and that your oxygen levels are still low.
Yes, yeah. Hi, everyone. I think what Nelia said is really important because it does play with your mind. My biggest fear is that I'm not going to lose my brain fog. I schedule meetings for after 10 in the morning because my mind isn't that clear when I wake up. The pain is excruciating. It's like shingle pain. My SATs dropped to the upper 60s, 70s, and we got it up to the 80s. I chose not to go to hospital. And I had a wonderful palliative care doctor, who's a volunteer doctor at our hospice, who looked after me and checked in twice a day, and my clinical services manager, who's also on the chat today. And I honestly believe that they saved my life. I'm the only person in the world, I think, that got COVID, didn't lose 30 kilos, but gained 7.
Weight gain comes into the survey as well, and just while you're chatting, Tertia, for those of you who've asked, I've posted a link to the survey just because it's quite an interesting read in the chat. Sorry, so but the weight gain, lots of people have complained about it.
Yeah, good. I'm gonna read it right now. But I was at home. My husband's 82. My grandson is 21. Our housekeeper is in her 50s and a severe diabetic, and I isolated, and nobody else went down with COVID. So I was really very, very happy. I wouldn't like to have somebody's death on my conscience, but it's scary. It really, really is scary, and I just hope that it's not everlasting. I did read an article that said that the neuropathic pain is due to low oxygen levels and that it damaged nerves. And as I say, I'm still battling with low oxygen levels.
Sure. That must make you frightened that the oxygen levels, if they stay low, the neuropathic pain is going to go on if that's been the cause.
Absolutely.
So, but thank you for sharing that, Tertia. Andrew?
You know, actually, interesting enough, Julia, just while you were chatting, a press release came through. And what was interesting for me, it came through from News 24 on the French rugby team, Stade de France. And they revealed that they're actually, they've picked up with some of their professional athletes who've had COVID, that they've actually developed lung lesions and that they're putting them off on extended rest. So here we're talking about professional athletes at the prime of their fitness. So, you know, again, an interesting thing just to look at. And again, the recommendation is lots of TLC and R&R. So yeah, definitely something to realize that, you know, it happens to the best of us. Yeah, so I thought that was interesting to share. if anyone was interested.
I think it is interesting. You know, we've all been told that, you know, obviously advancing age, pre-existing conditions, but, you know, a lot of the people that responded to my very informal survey are young and fit and are runners. And, you know, it seems to affect kind of everyone. It's well, not everybody, but it's not, this virus doesn't discriminate.
Yeah. Did you pick up any research on COVID toes? I read about it a couple of weeks ago and made the fatal error of Googling it. Don't do that.
It's pretty awful. I didn't do a huge amount of reading, but it has been documented, and it's usually because of the clotting problem, and it does need to be addressed with and that's why I think the Clexane and the anti-clotting medications are being used to prevent things like COVID toes.
My husband got a COVID toe, which made him realize he definitely had COVID. He just woke up in the night with a sore, red, swollen toe, and a few of his friends said it was gout, so he was very unimpressed with them, but it wasn't gout, it was the second toe. It seems to be a vasculitis, and it's most common in adolescents. So again, my husband was very thrilled that he got an adolescent symptom. It just went away on its own. Interestingly, he complained again last night that it had come back, so not sure what that's about, but yeah, it's definitely not as painful as gout. It can affect one or two toes or all the toes, and in other countries it can be confused with chilblains. It's that typical sort of chilblain look and pain. But it is well described, and as I say, interestingly, among adolescents. I've had two friends send me pictures of their son's toes. One, it was all the toes, and the other, it was two toes, and the father had COVID. Interestingly, they both tested negative, and in an article that I read, it also said that patients can test negative. Whether this is an after effect of COVID and they've already cleared it, I'm not sure. But it's again another interesting symptom. I didn't read anywhere that you needed to automatically go onto Clexane or anything for just the COVID toe. And asking back, I've heard of a few people who had strange toe pain and symptoms in February, but nobody knew what it was at the time. I know one of our neighbors who'd come back from a skiing trip, and we were starting to talk about COVID, but he said he got red, swollen, painful toes, and he went to the GP and they didn't know what it was. And now in retrospect, he's wondering if he didn't have COVID. And I think a lot of people are going to be keen when good antibody tests become available. It will be interesting to see, in fact, who has had COVID without even knowing it.
Yeah,
and hands up who isn't checking their toes at the moment.
I see the comment that thrombophоб cream and heparin cream 3 times a day is very soothing. So for COVID toe.
Yeah, and also a question from Barbara around hyperbaric therapy would be an option for neuropathic pain, perhaps.
I wonder if it's caused the oxygen.
Yeah.
I mean, it's not my area of expertise, but it sounds like a very reasonable idea, unless there's any contraindications.
Yeah.
There was
Just
another question. Sorry.
Yeah, I'm just checking through the questions as well. I'm just wondering if, and also just checking if there are any hands up at the moment, if anyone would like to weigh in on the conversation.
I see that GV's asked about people being, not everyone testing positive in a family. It's certainly our experience here in KZN is that there are numerous false negatives. Because, and I think it's the way the testing is done sometimes. I've watched people have their test done, a pharyngeal swab, and they're so busy gagging. And I think the swabber is so frightened of getting vomited on that I don't know that they always get to the back of the throat very well. So certainly we've had a number of friends and local doctors who've, out of 6 people in a household, 5 are positive, and 1 who's also sick with symptoms has been negative twice. So I think that there is this false negative. I don't know what the statistics are, but it does seem to be a thing, that if you test negative, it doesn't mean you haven't had it or you don't have it, especially if you're symptomatic.
Julie, I'm just checking. I don't see any extra questions. I don't want to start wrapping up just yet because it's only 4:45. But I just think, you know, in terms of a palliative approach to, you know, just a conversation around sort of a post-COVID experience. I mean, what would your recommendation be to someone, you know, besides the, you know, the kind of the support that they obviously need as a post-traumatic thing, but
yeah, it's really, to be honest, I think we should all be joining groups like this, and as Nelia was saying, sort of looking for some kind of counseling and just dealing with the anxiety and normalizing it. I think the more we can normalize how, I'd hate to want to use the word unprecedented this epidemic is. I think the anxiety that we're all experiencing is hugely normal. And I think we need to be dealing with it. We need to be talking about it. And as GPs and family or palliative care doctors or social workers, we need to be allowing our friends that space to talk about the fear. And in a non-judgmental way. I think I've really seen this bring out the worst in some people and the best in others. There's, at the moment in KZN, because we've had our surge has been quite recent, it's sort of, there's a huge sense of impatience and hugely judgmental. What do you mean you got it? You know, did you not wear your PPE properly? Did you wash your hands? You know, it's that old South African thing. If you have a smash and grab and your handbag gets stolen, no one says, I'm so sorry, your handbag was stolen. They say, where was your handbag? Was it on the front seat? Was it visible? Did everybody see it? And we love to blame the sufferer because that makes us maybe less likely to become a victim ourselves if we're observing all protocol. So I think it is just kind of being willing to have these conversations and help when we are feeling this level of anxiety that I think we all are. Judy, did you want to say something? You unmuted yourself a minute ago. Wait.
It's okay, Judy, don't worry. We're all on the Zoom boat together. Louise just shared a very interesting article. There's a conversation about false negatives happening in the chat, Julie. I don't know if you want to have a quick squiz. Just shared an article about that, which might be quite interesting for people to have a look at. And then I know something else that had popped up, and perhaps we can just touch base on it. It'd be nice to know. There was a conversation just around swabbing of patients who pass away at home for COVID. I know there've been a couple of letters that have been shared on a few of the WhatsApp groups, and I was just wondering if anyone has had any experience about that, any feedback about that. I know there was quite a bit of conversation. Might be interested if anyone could maybe just let us know on the chat. Sorry, Judy, I'll let you ask your question. Sorry, I was just jumping around.
No, I haven't got a question.
Okay, super. Thank you.
I like Margie's put a suggestion on the chat talking about, is there a role for post-COVID group therapy sessions? You know, do any of the social workers in the group want to address that? How do we do it?
I also see Martin Buck's got his hand up. Martin, hi, welcome.
Hi, Andrew. Yeah, I just wanted to comment on the thing what Julia said about anxiety, you know, and so on, what affects everybody. At Steve Biko and Tshwane District Hospital, we have put a support and care team for the staff and for patients and families as well. And that seems to work well. So people can go to the social worker, the psychologist, the pastoral counselor, one of the doctors. And that has been something we started a couple of weeks ago, and that's going well. They have also started a post-COVID clinic for patients with, you know, lasting symptoms and for follow-up. So maybe that are two ideas what others can also implement. Yeah.
Thanks, Martin. I see Diane's got her hand up as well. Diane?
Thanks. Hi, Julia. I did post a question earlier, but it's a very, it's not a very serious question. My husband and I have been on vitamin D for probably at least 18 months.
And then the last time I went to collect, they told me there's a countrywide shortage of vitamin D. Yeah, and literally there may be a couple of outlying Dorpies somewhere who may still have some. But I was just wondering if this is maybe due to vitamin D being prescribed at high doses, you know, in this situation. I don't know if you've got any comment on that, but I thought it was quite interesting because that's the first that I've heard about high dose vitamin D being used as a therapeutic agent.
Yeah, I mean, I think it is being touted. So I've been on daily vitamin D for a long time, largely because I've got a strong family history of melanoma, and there is an association with people who have got inherently low levels of vitamin D are more likely to get melanoma. And I think that more and more doctors are prescribing vitamin D, and it seems that a lot of us are really deficient. It's quite common. So I think there's that, and I think everyone's just jumping on the bandwagon. I haven't battled to get it yet in Durban. I'm still on my my vitamin D, but I'll let you know next time I go.
Well, you could start a black market. But thanks very much for that. And I think it's also probably a delayed sort of result of us being warned not to go in the sun, you know, too much, don't you think?
Yeah, sun cream.
Yeah. Okay, thanks a lot anyway. It was
a
really good conversation. Cheers.
Andrew? Oh, he's obviously on a...
No, sorry. I was just having a look at some of the questions that have come, comments that have come through. Yep, that seems to...
Yeah.
Interesting comment from Shireen here. It's essential to have a space to talk about the COVID experience and anxiety, which is an absolutely normal feeling during a very abnormal event. And I think to her point, I think people are also experiencing that kind of anxiety on top of all the other anxiety, on top of all the unknowing and, you know, uncertainty that's going on. So definitely something that needs to be addressed. So.
Yeah. Is there anyone else who's got any kind of experience of these long haulers that they're being dubbed, you know, or personal experience of patients or even themselves? I really hope not. Yeah, I think what I do want to say is that it just really relatively seems to be a small percentage of people that have very severe persisting symptoms, but they are there, and I think because no one can tell anyone how long it's going to last, and Tertia was talking about the brain fog and that memory loss. It is a terrifying symptom, and everyone wants to know when it's going to be up. So I love this idea of a post-COVID clinic where we can perhaps follow up patients that have long-term symptoms, and hopefully some good research will come out of that going forward, so we can start understanding what to expect and how long these things go on for. But I don't think it's the norm. I don't think everyone. I think more people have got no symptoms or very few symptoms. And as Jane mentioned, the antibody testing will be very interesting.
Thanks, Julia. And I think just to the point, also just to talk about the care post, and I think a lot of it is just, you know, reaching out to friends and colleagues to support them during, you know, during the time, especially during and post, as we've said. So as always, a very, very interesting conversation. Looks like we're going to wrap up a bit earlier today. It's almost 5:02. So thank you everyone for contributing to today's PalliCOVID conversation. It's always wonderful to see you. The conversations are always quite rigorous, so leaves me a lot to Google after these meetings. So thank you very much. Stay safe, stay warm, and yes, we'll see you next Thursday. And we'll keep in contact on the chats. Take care, everyone. Thank you.
Bye.